Joining us now, and we're very excited, is Dr. Peter Bastone. Now, Dr. Bastone, he's president and CEO of Chesapeake Regional Medical Center. Now, let me tell you about Chesapeake Regional Medical. It's my hospital. I live virtually a mile away. I had to take my mom there several times recently. My mother, Dolly. These guys are fantastic. I am really blessed to be by Chesapeake Regional Medical Center. They do a fabulous job, and we welcome Dr. Peter Bastone, again, President and CEO of Chesapeake Regional Medical Center. Peter has more than 3 decades of healthcare leadership experience with organizations not only in Chesapeake or Virginia, not only in the United States, globally, around the world. Welcome to the program, Dr. Bastone. Great to have you, man.
Morning, John. Thank you for having me.
Hey, look, I feel like we're neighbors because you're my hospital. And just recently, my mom, Dolly, who's 87, had some real issues. She had 2 bouts with pneumonia. She had broken vertebrae in her back. She had a broken rib. So 3 times we had to take her into the emergency room, and she was in your center, I think 3 separate times or 4 separate times in the fall. And, I got to tell you, we'd go in and visit her. We'd take her there. But the doctors, fabulous. The staff, fabulous. The RNs, fabulous. It was just a great experience. And let me tell you the other thing weird. People always complain about the hospital food. The food was good. She ate it all. She said it was fabulous. So not only do you do fabulous medical work, but you serve good food. What's up with that?
Well, you know what? I eat all 3 meals here every day, to say the least. But we're very pleased. Thanks for your comments on that. We're definitely a ministry of caring for our community, and something that is not only entrusted to us, but it is a very values-based organization. Very pleased to been called to provide the leadership here.
You guys just do a fabulous job, and I've been Dr. Bastone. I've been ringing the alarm bells now for months about what I'm calling the hospital crisis in Virginia, and it's like nobody's listening. Yeah. My listeners have heard me talk about the importance of hospitals for jobs, the economy, and basic care for months. But, being you're on the program, I was excited because you're my home hospital. And it's just one hospital. Now, across the Commonwealth, the economic and the health benefits become multiplied. Virginia hospitals directly employ, get this, 115,000 people in good-paying jobs. They generate $36 billion, that's billion with a B, billion in economic activity. They have a combined $8 billion payroll, and they spend $17 billion on goods and services with local businesses. Now, this is just in Virginia, right, which stimulates local economies. But as I continue to tell people, that's all threatened by factors beyond hospitals' control. Can you share with our listeners, Dr. Bastone, the genesis of this crisis?
Sure. Well, first of all, Chesapeake Regional was opened in 1976, and it was really a rallying cry by the community to build a hospital. This hospital was built from car washes and bake sales and the commitment to the community and the city of Chesapeake. But the thing is that we never encumbered the city with any expenses. We operate on our own. We're freestanding. We're focused on fulfilling our ministry and mission of caring to improve the health of our community. We do employ over 2,100 people. We're one of the largest employers in the city of Chesapeake. We generate about $263 million in economic activity, and we spent over $43.5 million on goods and services in the area as well. And on top of that, each year, we are focused on providing charity care and community benefit for our community. And this last fiscal year, we provided over $40 million in community benefit and charity care for not only the people of Chesapeake, but of Hampton Roads. But our challenge is as a hospital, we talk about big numbers, and we're not part of a large health system, so we're very, and like we're only one of 6 hospitals that are left that are independent. But we have to deal with significant commitments. We provide free and discounted care by government policy that goes back decades. Medicaid and Medicare are about 50 years old now, and reimburse hospitals way below their costs, really at pennies. We receive about 19 cents on the dollar from Medicaid and maybe about 24 cents on the dollar from Medicare. So even though people see that we're being reimbursed, we're not being reimbursed to cover just our cost. The federal law 30 years ago passed the requirement for hospitals to treat all individuals coming to our emergency room, no matter what their ability is to pay, which again results in a significant amount of uncompensated care. People in Hampton Roads don't realize that even though we're not part of the larger health systems like Centera or Bon Secours, we're the second busiest medical center in the region, and we're the busiest emergency room, seeing over 75,000 visits a year. So we're definitely an asset that needs to be maintained and protected. And again, it's kind of crazy because of that dynamic of accepting everyone about the ability to pay, and a lot of business leaders question, why don't we act more efficiently or whatever? I said, I could just imagine going into a car dealership in the area and asking to buy a car and say, well, I'm not going to pay you for that car. I'm just going to drive it off the lot. You can have the next guy pay for it. So it's a real interesting dynamic and business structure that we have. But we certainly have, we have our challenges. We have a lot of financial strain as a hospital. We had a challenging year last year with a negative operating margin, but we had basically over the last 18 months a $30 million turnaround, and we're very pleased with that. It took a lot of hard work. It was painful. But we're dealing with a lot of the significant cuts and issues that we have in our area.
Look, Dr. Bastone, you are right there with it. By the way, we're with Dr. Peter Bastone. He's the president, CEO of Chesapeake Regional Medical Center right here in Chesapeake. This is my hospital, so this is very close to home. This is where I take my family. This is where I took my mom in the fall when she had her issues. But I just want to reiterate to our listeners a couple of things that you just said, Dr. Bastone. One is this. You're only one of 6 independent hospitals left in Virginia. One of 6, okay? Now, secondly, a lot of what you said, and I love your analogy about the auto dealership, because that's basically what it is. You come and you say, I need a vehicle. This is what I like. Fine, we're going to set you up. I can't pay. I don't have insurance. Fine, just drive it off, and somebody else will pay for it. You're exactly right. Now, it puts Virginia hospitals in a real catch-22, which is unfortunate because, as my listeners know, I'm not a fan of Obamacare. I think it's been a disaster. Certainly has been for our family. But we also live in the real world. And the law's been in place now for 6 years. It survived Supreme Court challenges, congressional repeal votes. At some point, our state policy has to adapt to present conditions. Now, some of the most common complaints from people resistant to Medicaid expansion is that Virginia will still have to pay 10% of the costs and that we can't count on Washington to fulfill its promises, right? Here's my response to that. Hospitals have said they're willing to talk about covering the 10% state cost themselves. So if the argument is, look, we can't pay the 10%, it's too high, it's too much, and the hospitals say, well, wait a minute, we'll pay that. And then as far as Washington's funding is concerned, Dr. Bastone, I just can we just be honest with each other, please?
Yeah, the issue is that it's kind of a Trojan horse. I think the frustration is that the hospitals have already taken a haircut from Obamacare and the Accountable Care Act of millions, barely billions of dollars. So basically, our hospital here at Chesapeake actually had to take a reduction in Medicare reimbursement to the tune of $6 and $8 million each successive year since Obamacare has been implemented, and that money is not staying in Virginia. It's going to other. That's what's funding, the Medicaid expansion across the country. And since we don't have the expansion here, we're losing that money. And now, so this is kind of a ploy to, without legislative support, to tap into the federal fund capable of doing a matching if we tax ourselves. Now, being from California, it's a Trojan horse because you have to make sure. California is a lot different than in Virginia. California, there's a state deficit. Virginia, I think the legislative leadership here has been very strong in making sure the integrity of the budget is strong and maintained, and they look into the future, and they don't want to put the future of the state at risk financially if you can't sustain it, and sustainability is the key here. And the thing is that for the short term, great thing. But the thing is, with the hospitals, there'll be winners and losers. There'll be certain hospitals that take care of more of the poor and the underserved versus not. But ultimately, the feds are going to get smart to this double dip and will eventually close the loop because budgetarily it doesn't make sense for the long term to deal with that loophole. And then ultimately the state will be back focusing on itself and how are we going to continue to fund the coverage. The other thing is to make sure that none of these monies, if in fact we support the if it goes through, does not go to the general fund to do something outside of health care. We can't. That money can't go to build bridges and prisons and things of that nature. It has to stay within health care because we're taxing ourselves.
Right. So there's two basic arguments against tapping into the federal funding to help hospitals in Virginia. One is 10% state has to pay. That gets out of control. You look at other states like, Arkansas, Kentucky, West Virginia, wherever they've implemented this, whatever the 10% they estimated, that's gone up dramatically. But hospitals are saying, look, we're willing to pay that in a special fund, a lockbox, if you will. Second argument, you can't count on the federal government because, they got a $19 trillion in debt and you might never get the money. Well, here's what I say to that. Virginia's budget, like you just said, is built on billions of dollars. Our whole economy is built on billions of dollars flowing in from Washington every year. So without federal money, we wouldn't have schools, we wouldn't have roads, we wouldn't have anything. I mean, Virginia, of all places, it's like it feeds at the federal dollar trough. Now, Dr. Bastone, the General Assembly is about to convene. It starts next week in Richmond. I'm going to be up there most of the week, broadcasting right across the street. The expectation is that serious healthcare policy discussions are going to dominate a lot of the General Assembly. Now, this provider contribution concept where the hospitals pay the 10% in lieu of the taxpayers of the state is likely to be one of the topics, right? I've told you it makes a lot of sense. Now, as you say, Dr. Bastone, this isn't the hospital's first choice, but you guys are trying to be flexible, trying to find compromise by offering to do something they'd rather not do. Hospitals are hurting. I've been saying this for some time. We need to do something to protect hospitals. The hospitals have put a concept on the table for debate. They'll pay the 10%. If the other side doesn't like it, I want to hear a counter proposal. Am I making sense at all?
Oh, so certainly. I mean, there's no question that the provider contribution concept is complex. And really, to simplify it, is that the approach is flexible enough to be used to support the Medicaid population and extend health care coverage to thousands of uninsured Virginians. The difference, though, is it focuses on the existing program that brings back millions of funding back from the feds to the uninsured population. It will mean billions of dollars to Virginia specifically. And it's really an attempt on the hospitals to facilitate at least a meaningful dialogue with policymakers to really help achieve a bipartisan compromise and policy solution to protect access to care, for Virginians. Now, and the thing is, we will, it's very flexible. The only concern I have, being from California, is making sure the money is spent in the right way and focused on health care and nothing else.
Okay, we're out of time, Dr. Bastone. I want to go over COPN, which is a very big issue for us. Peter Bastone, he's a president and CEO of Chesapeake Regional Medical Centers, been all over the globe. And Dr. Bastone, first I want to say I know you had to move your schedule around to accommodate us for another segment. I want to thank you for that, sir. Good to have you with us.
It's great to be back.
All right. We were talking about the fate of hospitals and healthcare in Virginia. It's one of my big issues in 2016, just to make people aware of what is exactly going on. But the other big story, the other thing, and this is a big issue now in the General Assembly, Dr. Bastone, is the Certificate of Public Need. Let me just lay it out for our audience. It's called COPN. It's another one of these crazy acronyms that nobody knows what the heck it is. Okay, it's complicated, but let me just give our listeners the short story. Healthcare is not a free market because you're regulated by the government. You have to take in people without insurance, people who can't pay, indigent care. You have to offer services that you lose money on. You get 50 cents on the dollar on some of the stuff under that. So we don't have a free market in healthcare. Government tells hospitals what to do: provide substantial free and discounted care. Basically, these are unfunded mandates, the things that I complain about every day in the federal government. In that system, the COPN, or Certificate of Public Need, is a state process that exists to review applications for new medical facilities, services, and equipment. It applies to hospitals and other healthcare providers. It prevents overexpansion the market won't support and helps control cost. Bottom line is, you have a lot of services you lose money on that the government says you have to offer. Somebody comes in, indigent care, emergency room, no money, no insurance. You lose money on that. You have to provide them the care. Now, there's some things that are profitable. If you do away with COPN, the free market, baloney, because then people come in and they just cherry pick your most profitable services you have, and then the whole system collapses. How does this make any sense?
Well, it really doesn't. I mean, really, I guess for your listeners, the certificate of need is really kind of it's like when a municipality is working with a developer to plan a community. It's a planned healthcare community, and you're exactly right. I mean, believe me, if the CON law goes away, these new facilities that are going to be pushed by the huge major nonprofit conglomerates that dominate for-profits and physician-owned programs, I can guarantee you they're not going into the inner city. They're not going to go into downtown Portsmouth and open up some of these freestanding profit-making organizations because they're going to go where the insured white-collar population is located in Virginia. Now, what the COPN does is basically, number one, in 2013, the conditions that COPN requires is charity care. So if you go put a COPN in, and it could be a good business opportunity, but you also have to commit 3 to 4% of that to charity care, which means that in 2013, that COPN condition yielded about $1.3 billion in charity care for Virginia. If you don't have a CON, that doesn't occur. All that underserved charity will be filtered back to the hospital because we're required to do it for free. And the thing is that there's going to be a vicious cycle as it relates. And I'm going to break it down into three things: how it impacts Virginia, what happened in Pennsylvania, and what happened in California, where I came from. And I think the reason why I was hired by the authority to come to Chesapeake is to make sure we don't make the same mistakes we made in California in Virginia. And hopefully that can be heard. So we say basically $1.3 billion in charity was generated by the COPN condition for Virginia. You stated very correctly. Healthcare is not a free market. Government decisions over the years have impacted and explicitly determined that healthcare access in this country is not just limited to those who can pay. And those decisions leave hospitals picking up the costly tab for patients who can't pay. Number three, Virginia hospitals endured a combined $2 billion Medicaid shortfall between 2008 and 2014. And over the same time, the hospital provided more than $3.7 billion in financial assistance to the communities within Virginia that serves charity care and reimbursement shortfalls for Medicaid and Medicare. Healthcare in Virginia is also, you have to know that we're probably the most effective of most of the states that have COPN laws. Actually, our per capita healthcare costs for expenses are lower than 10 of the 16 non-COPN states in the country. Eliminating the certificate need will not improve healthcare for patients or providers. It won't provides on the long term. Competitors will come in, like you said, cherry pick certain services in detriment to the broader scope of service that's provided by the hospitals.
Yeah, so all you're going to get basically is, short-term gain, long-term pain. So somebody comes in, they cherry-pick the most profitable services. Maybe those rates come down in the short term, but then the hospital suffers. And like what happened in Southwest Virginia, they just go out of business. You have no hospital. I mean, This is just common sense. But, Dr. Bastone, the problem is with when these people come on and talk about free market, COPN, it's like Pavlov's dog. Oh, free market, free market, free market. It's kind of like these trade deals. Oh, free trade, free trade, free trade. It's not free trade. It's managed trade. It's not a free market system in hospitals. It's managed and mandated by the government. So the whole thing's apples and oranges. Look, Dr. Bastone, I couldn't agree with you more on this issue. Healthcare, guess what? It's not a free market. Hospitals provide a range of services the public needs, everything from obstetrics, psychiatric, trauma care. Some are profitable, many aren't, but you still have to offer them. But hospitals have to provide all of them because they're a necessary part of the community. Eliminating COPN isn't going to improve health care in Virginia. It's going to make it worse. It'll allow profiteers. This is crony capitalism on steroids, all right? Because all it's going to do is allow a few profiteers of the donor base of some of these politicians to pick out the few profitable services so they can compete for hospital patients for the only services that hospitals make money on. So long term, that hurts hospitals. It hurts the public because access to certain services will become limited. Already in many rural areas of Virginia, hospitals have to scale back obstetric services. COPN is an important system. It's worked. It should remain intact. Agree?
I totally agree. I was going to mention, in California, when I was in California, there was definitely a huge influx of investment in those ancillaries and those services, geographically specific, where you had high income areas that people were insured. But over time, the prices go down initially, but then you filter out all the competitors that can't make it after that investment, and you end up with fewer providers, and then the costs end up going up again. In Pennsylvania, you mentioned that the number of general acute care hospitals fell once the CON law was passed from 206 to 177 with that repeal, and that was about 14.1% decline, more than double the national rate of 5%. And over the same time, the number of surgery centers quadrupled, growing from 44 to 177 at a growth rate twice the national rate. I mean, it's a Trojan horse. It looks nice. They call it free market. It isn't. You put everyone on the same playing field with the same requirements and the same level of guidelines that we're required to provide by the government, then we can talk. But if it's just a cherry-picking thing where they're going to pick and choose what services actually make a little bit of a margin. My margin as a hospital is maybe about 1.5% to 2%. What kind of companies do that? I'm talking about Costco and Sam's Club. I mean, that's the kind of margins we're working off of, even though the numbers seem very big. Like I said, I write off 70 cents of every dollar we charge.
Unbelievable.
And then after that, then we pay our bills, and hopefully at the end of the day we have a bottom line. But if your callers and your listeners really want to have some good information that they can review to get a better understanding of the scope of the issues and challenges, there is a website called visit isupportvirginiahospitals.com. And again, it's isupportvirginiahospitals.com. And you can really spend some time in understanding it. It's not rhetoric. It's not BS. Basically, we're at a point in Virginia healthcare that can either help us maintain and try to sustain and hopefully advance into the future, or you're going to be in a situation like California where you're going to have, or Pennsylvania, where you're going to have significant closures and significant hospitals at risk of closing.
All right. Look, great dialogue, Dr. Bastone. I really want to thank you for coming on. Thank you for your time today. I know that Virginia's hospitals have been communicating these important messages with the public for a long time. To our listeners, you can go to that website. I also want to give a shout out here. One of my listeners just came in to tell me that longtime political activist in Virginia Beach, Kenny Golden, is in Prince Anne Hospital. He's seriously ill after a hip replacement that didn't go well, and wanted me to give a shout out to people to pray for his recovery today. Doctor, thank you so much for being with us, Dr. Bastone. Thanks for the fabulous work that you do at my hospital, Chesapeake Regional Medical Center. I look forward to having you back, and I'm going to go over there, and you're going to take me to lunch downstairs in your cafeteria, which we actually do. We actually have to have a good time eating there.
I just want to make sure, God bless you, stay healthy. We don't need to see you here.
Hey, and thank you for taking such good care of my mom, Dolly, when she was sick. Thank you so much.
Thank you, sir.